Good morning, everybody. I think the recording has already started. So my name is Nathan Burrows. With me today is Craig Van Fleet. We're going to be presenting today about some research we've done on childcare subsidy trends in the United States using secondary data. We're going to leave time for questions at the end. I'd really like to have a robust conversation about this. So I'm going to try to share my screen. Craig, let me know if this doesn't work successfully. All right. Are we good?
Yep.
Excellent. All right. So the purpose of this study was to use secondary data that's available from a variety of different sources, but primarily the CCDF administrative data series. My colleague Craig will talk a little bit more detail about this. But this gives a sample of data that's released to the general public and to researchers. And it's the sample that includes some really interesting variables that you can use to identify what the demographic characteristics of childcare subsidy using families have by state, and it goes back to 2001. So it's a nice long period of time. I'm from the American Institutes for Research. My colleague Craig Van Fleet is with Public Policy Associates. And this was funded by OPRE ACF as part of a secondary analysis grant. So we thank them very much for their support of this program. So for those of you who don't know, the Child Care Development Fund includes a child care subsidy program. This has a couple of different purposes, including supporting participation in the workforce, as well as child development. This is a subsidy which is a block grant to the states. There are federal requirements that indicate sort of how this needs to be structured. These are minimums, but individual states are able to create their own specific rules in terms of eligibility and a level of, whether there's a co-payment, the size of the subsidy, et cetera. They can also top off these programs and put more of their own state resources in it above what's in the federal amounts. Oop, and I've already messed this up. Okay. So according to the ACF, there's been a major change in the makeup of what kind of providers receive the child care subsidy. The number of home-based providers has declined steadily since 2005 through 2017. This is according to ACF data. But we have some additional data that's come out in the last couple of years that indicates that the number of home-based providers that are using the subsidy has declined. So there's been a real important shift in the makeup of how families are using the subsidy to get childcare. And as you can see, in terms of number of enrollees, number of families that use it, about 2/3 of families in 2009 were using centers, but that's gone all the way up to 80%. So the question that we have is, does this compositional change in how the child care subsidy program is used, has this had any implications with respect to equity of access to childcare? There's a fairly well-developed body of research literature that indicates that low-income families are less likely to use center-based care, and that center-based care had better academic outcomes. Because of that, there was a shift in policy in 2014 as part of the reauthorization, which, whether deliberately or not, really advantaged childcare centers at the expense of home-based settings, which is why we may see a continuing decline. But you can tell that actually existed before 2005, so it's not a fully causal explanation. So the key question that we really wanted to address with this project was, first of all, what was that long-term trend by race, ethnicity, and income? There's been several one-year studies that have looked at, as a cross-sectional study, what percentage of CCDF recipients from a given state or nationally are from these different groups. But because of this secondary analysis, secondary data that exists, we're able to really draw a clear trend line to look at how the composition of participants has changed, not just in the program overall, but also differences by what kind of care that they're using. And that leads to our second question, which is, how does that growing prevalence of center-based care influence equity in CCDF subsidies? There's some research literature which indicates that families in deep poverty or Hispanic are less likely to want to use centers, whereas African American families are more likely to use centers. So we wanted to sort of elaborate on that research and say, well, has this shift from to increasingly center-based care through the child care subsidy program, has this made it less likely for Hispanics and African Americans to have access to the program, and also to take another look at the prevalence of African Americans in the program? And finally, there's some interesting statistical questions in terms of how you measure eligibility. Because states have different rules, we wanted to look at how changes in state rules over time are affecting subsidy eligibility. And we're focusing on the family unit as opposed to individually by child, to really determine whether we're seeing sort of a bigger gap between what's the federal standard that we would expect, or if you're just looking at, say, percentage of poverty in a state, or do you really have to incorporate a really robust examination of the state rules in order to have a good measure of how many families overall are eligible, but particularly whether those rules have a disproportionate effect on families with certain backgrounds? And with this, I'm going to turn it over to Craig.
As Nathan noted earlier, this relied heavily on the administrative database, which is hosted and administered by ICSPR. We also utilized the American Community Survey micro area data from 2009 to 2019, cross-referencing that with the Urban Institute CCDF policy database. So first, what we did was we created our estimates. And to do that, we cross-referenced that CCDF policy database with ACS micro area data to see who would be eligible. And we did that using employment data and school attendance data, as well as income. Excluded from these estimates are families who are eligible for reasons such as TANF, or looking for employment, or medical or additional family preservation reasons. We only have estimates based off of income and school attendance. These estimates were then, of course, aggregated up by various different subgroups, such as race and poverty level. We combined all this different CCDF administrative databases, data files together to create a large database of data from 2009 to 2019. These were also aggregated up based on subgroup definitions. Poverty status was in the ACS micro data. They provide a poverty status. In the administrative databases, they do not. So these were cross-referenced with federal poverty line data for each year based off of family size. And then next, we created multi-level models for aggregate level analysis. Providers were nested within states to determine the impacts over time and the trends. We analyzed using both trend time effects and fixed and random time effects nested within states. And then finally, we used the individual level data within the administrative database to predict the likelihood of a child enrolling in center based off of various subgroup identities.
Okay, thanks. And again, we have a working paper we're releasing on this soon that you'll be able to get more of the technical data. But if you have specific questions, we can try and answer those at the end of our presentation. All right, so the big thing that we want to focus on today is what sort of the aggregate level trends are over time, which aren't necessarily widely publicized, and I don't think people are widely aware of these. This is the first attempt to use this data that we're aware of that merges the ACS and the CCDF administrative data and the Urban Institute data to track this over time and by subgroup for all 50 states. So what do we find first? Well, as some of the literature has indicated, African Americans and Hispanics are more likely to be eligible than white families as a function of the higher poverty rates and differential employment rates that we see in this population. What we do not see is a substantial long-term trend. I want to make it really clear that what we're looking at here is the share of African American, white, and Hispanic families states that are eligible for the CCDF once you take state rules into account. So as you can see, that's been a fairly steady proportion for each of them over time. So you do not see a major shift, for example, after the reauthorization of 2014. And again, I want to note that this is all pre-pandemic because the CCDF administrative data to date only runs through 2019. We're hoping in the future that we'll get additional data years so we can see what the long-term effects of the pandemic were for this sort of analysis. This is what I think is one of the more fascinating outcomes of the work that we've done. We found that roughly half of the families that are eligible for CCDF are between 50% and 100% of the federal poverty line. So in other words, those in deep poverty below 50% of the poverty line make up about a third, around 30% of eligible families, while those who are above the poverty line make up around 10% of eligible families. So you really see that this program, although it's designed to help families in poverty, perhaps because of the work requirements or other factors, which we look to explore in the future, it really seems to be geared in terms of eligibility. The families that could be getting the program, making benefit of the program, are in that 50 to 100% range, rather than families who are at a much lower level of socioeconomic status. So that was about eligibility according to state rules and federal guidelines. This is about how many families are actually making use of the program in every year across the states. And here we do see a significant trend over time. In general, white families appear to be taking up a smaller share of all CCDF recipients over time. And the percentage that are Hispanic has been going up. This could be a reflection just of long-term secular demographic trends, as the white population with children under the age of 13 has been declining over time, and the percentage of those families who are from Hispanic backgrounds has been rising over time. But that's a supposition that we'll have to do some more work on in the future. But this does indicate that there is sort of a convergence between the share of CCDF recipients that are white and Hispanic, whereas African Americans continue to represent the largest share of program beneficiaries. What's really interesting to me is that according to our analysis, using the CCDF administrative data, a plurality of those who are actually receiving the program, receiving benefits, are actually above the federal poverty line of 100%, and that share is growing over time. And there's been a slow decline in the share of recipients that are in deep poverty or between 50 and 100%. So this is a real difference between what we saw earlier in terms of eligibility, where most of those who are eligible are that group between 50 and 100% to poverty. But most of the actual recipients of the CCDF program are actually above the poverty line. Now, that doesn't necessarily mean they're wealthy. The poverty line is quite low. And if you used say, for example, an ALICE standard, you might get a somewhat different outcome for this analysis. But it does indicate that there's a real disjuncture. And why this is the case and what, it could be a lot of things that we're going to be looking into in the future. For example, one thing that I'm particularly interested in is a question of administrative burden or community resources and support. Is it just families who are above the poverty line? Are they better resourced and supported to make use of this program? And another question in terms of the trend line, some of this change may be due to long-term changes in the percentage of families that are below the poverty line, which would be a compositional change over time. But I still think it's a rather striking finding. So next, we're going to be talking about center enrollment. So far, we've just been talking about CCDF participation at all. Here, we're looking at the percentage from each socioeconomic status that are actually participating in the program and using it for centers. That number has been going up steadily over time, as you would expect, because overall CCDF reliance on centers has been going up. But it does look, since 2014, and particularly since 2016, there's been a significant increase in the percentage of families that are in deep poverty enrolling in centers. So it looks like they're more reliant on centers than they were prior to the reauthorization. Although, again, this is somewhat a correlative rather than a causal, so we have to be very cautious about making any attributions on that. But it's an interesting finding. By race and ethnicity, we again find the percentage of Blacks and whites that are using the CCDF program for center care has steadily increased over time. But the percentage of Hispanic families that are using centers is a lot flatter. It's still increasing somewhat, but it's a much slower trajectory. And this reinforces some of the prior literature, which indicates that Hispanics are less likely to use the program. What's interesting is that there wasn't a big difference between the three groups in 2009, but that gap has really opened up over that 10-year span. So it does appear that as center-based care becomes more important for the CCDF program, that it could be having a disproportionate effect on Hispanic families, making it more difficult for them to access care. All right, so that was all aggregate level results. Next, we want to talk for a few minutes about some of our more complicated regression models, where we're looking at state level fixed effects analysis and the like, where we're trying to control for what's happening at the state level to look at the likelihood that an individual family with a given characteristic is participating in the program. So while controlling for state level effects, we found that Hispanic families and those in deep poverty have been less likely to use CCDF subsidies. And so that's consistent with the literature and with the trend line that we saw. But we didn't see a difference over time. So we didn't see any break point after 2014 or any long-term trend in the likelihood that families the likelihood that a particular CCDF recipient was Black, Hispanic, or in deep poverty. So you're not seeing either an expansion of inequality or a reduction in inequality in CCDF utilization over time. With respect to center-based enrollment, we found that controlling for other factors at state level effects as well as individual characteristics, we found that subsidy users who are African American and Hispanic are less likely to enroll in center-based care than whites. So this individual level model sort of reinforces what we found with our aggregate analysis for Hispanics, but finds something a little bit different for African Americans. And that difference is big enough for us to want to take a further look at in the future to determine why we're seeing that difference in results between what our aggregate level trends are and our individual level models. However, as with our aggregate level models, we do not see any difference in center-based enrollment over time. So the likelihood isn't really changing based on each group. Even though the overall percentage is increasing, there's no differential impact across groups. So all users appear to be increasingly likely to use centers over time. So that's controlling for state level effects. It's sort of washing out what we see at the individual state level to get an overall national picture. But of course, one of the really cool things about this data is you're able to kind of tease apart what's happening in individual states. So I'm going to turn it over to Craig to talk about that for a little bit.
Yeah, so this graph shows that the changes in the state level threshold for income, as well as the additional eligibility criteria over the 10-year period. And we see that states vary somewhere from 1 to 16 different changes, and a change in this case is defined as like a different entry within urban databases, within Urban's database. So one change may actually include 5 changes of eligibility with it. But we see that states can vary in the way that they change the number of thresholds and eligibility criteria. I want to say that the average was like 9 changes in threshold and 8 changes in eligibility criteria over this 10-year span. And this type of difference in not only like base eligibility criteria, but constantly changing eligibility criteria could really create these large differences while doing this estimation. And if you go to the next slide, I'll show that a little bit. So this is comparing like the more broader federal rules for whether or not someone is eligible for the subsidies, and then the actual state rules that define themselves. And you see that they start to separate once we reach that 2014 level. And this really shows like how much you have to control for that state level variation in eligibility criteria, because states have a lot of power and a lot of influence in setting those, and they've been really utilizing those over the last 5 or so years. So just using the more broader federal rules doesn't give you a very accurate picture of the number of families that are actually eligible.
Okay. That is what we have for our presentation. We wanted to keep this short and sweet. I'm going to stop sharing my screen. And then I haven't been monitoring the chat. Okay. So I see a comment from Tamara. Jenny, can you confirm with me, are we able to take people off mute so they can ask their question, or do we have to read it off of the chat?
I can try and return control to people. Give me just a minute.
Okay. So I'm gonna assume everyone's going to observe protocol. So please raise your hand before jumping in, assuming we can do this. But I did want to say, point out, yes. So as Tamara mentioned in the in the chat, there does seem to be a break. Can you identify, Tamara, which slide that is that you're referring to? Just so we're clear. If you want to put it in the chat for now, if we haven't been able to get anybody off. Not off mute yet. Okay. Do I have to take you off mute? I can't find you, Tamara. I see Teresa. All right. So clearly I need to work on my technological capacities.
This is being recorded, and it should automatically send a copy of this out if you registered. If not, we are also planning on uploading it onto our YouTube page, and I will share that out. If you want copies of the PowerPoint slide, we can arrange that. I don't know if my email is somewhere on these slides, but I can share my email, and you send me a request. I'll send you a copy.
Hi, Nathan.
Yes, hi.
So the slide to which I was referring, I think it was the slide after the eligibility. It might have been the first utilization slide. Does that help? Because I don't know what number it was.
Sure.
It's either first or second utilization slide where.
Oh, the share of CCDF enrollment by income. Yeah,
Yes.
the big change is around 2014. Thank you for reinforcing that point. Yeah, so we definitely see a change in what's happening with participation by income. So thanks. That's there's a lot going on here. Jonathan?
Can you hear me?
Yes.
Okay. So I have two related questions, and so you should ignore the one that bores you most. But I was really interested in the results about the income distribution of participants and how participation by income changed over time. And so the two questions that made me think about, that I wonder if you know the answer to. First of all, with respect to really low income folks, do you have a sense of what is happening to the number of Head Start seats over the same period of time? Because it strikes me that that is something really interesting. My impression is the number of Head Start seats has not been growing, which would make it, I guess, even more surprising that the folks under the poverty line are not having their participations grow as much. And I suppose the second thing that's related to that is one thing that I think is really interesting is in a lot of states, the eligibility level is tied to the state median income, and that potentially has an effect of changing whether or not lower income people in a state are eligible based on what happens in the economy to higher income people. And I was wondering if you had kind of learned anything about the impacts of different state eligibility rules on who participates.
So on the second point, my colleague AIR Stephanie D'Souza has a new research project that's looking precisely at the cost of living impacts on some of these questions. So she will be able to ultimately speak to that. So that is very much at the top of our mind. I don't know if Craig, you wanted to jump in on that point as well.
Yeah, I want to say that over time, I don't have a quantitative answer, but over time, anecdotally, we can see that lots of these states are increasing eligibility criteria, not the threshold. So that means that they're having harder workforce requirements. And they are increasing the threshold. So that's one reason why you're seeing people above the poverty line. But some states are starting to require full-time employment. Some states are requiring like 35 hours. Mm-hmm. And so that's one major reason why you're seeing that dip in the people below the poverty line.
Fascinating.
Thanks. And I don't know the answer about Head Start, but I will definitely look into that. I'm not a Head Start expert.
I think you're right, though, in that Head Start has been slightly declining, like it hasn't been increasing, and it's just kind of been like slightly going down. But likewise, I'm not an expert. I've looked at that trend at some point. But
what do you folks think? Maybe if I can invite you to speculate, what's going on? Where are all of the really low income folks?
Probably at family and friends.
Mm-hmm.
Yeah, unregulated care would be my guess.
I would imagine they're leaving the formal market, and that they're having a hard time getting their family or friends subsidized by the program, depending on what the state allows.
Yeah, that's a guess.
Yeah.
Really quickly, there was a question in the chat how we defined Hispanic. We defined Hispanic inclusively. So if someone was coded as Hispanic in the CCDF database, no matter what race they were classified as Hispanic. So technically, the Black and white groups are non-Hispanic Black, non-Hispanic white. And we had other demographic groups in the sample as well, but they were much smaller in a lot of states. So that's why we really highlighted the Black and Hispanic families. Teresa.
Hi. I have a couple of questions too. First, how much variation did you see across states in this utilization by income? Because I know we've worked with a few states who have been trying to figure out how to do a better job of serving the lowest income families within their program. And we can compare them to national numbers, but were you guys able to kind of build out state by state that variation?
Yes, there is a dashboard that we are working on finalizing that will show a state-by-state variation of that utilization. I could tell you it varies a lot state by state.
Awesome. That'll be, I'm really excited to see that. And I think it'll be really helpful for states. And the other is like just a comment at that last slide that you showed where you showed like the complex looking at the rule changes and all that versus just like a simpler way of looking at it. Did it strike you that states are sort of moderating their eligibility criteria to keep the number of kids fairly eligible, fairly steady? Because it looked like the state with the complex line stayed fairly steady over time about how many kids were eligible versus the other line going up. So the feds may be thinking that they're increasing eligibility, but the actual number of kids who are eligible seem to be staying fairly stable. Was I reading that right?
Craig?
Yes, I think so. The feds themselves also do report a more complicated model using micro simulation data. So they have an idea that state level rules do seem to be impacting things separately. I think it's been a few years since they've released a report, but the ACF does like release reports out like, hey, this is what the eligibility would be based off of federal rules, and here's what it is based off of simulated micro area data rules. So they seem to be aware that states do seem to be having a different set of criteria than they expect.
Oh, thanks.
Great. Gina? Did you have a question?
Trying. There. Can you hear me now?
Yes.
I seem to be having technical. I can't seem to do anything with chat, so I've been inserting questions in the Q&A instead.
Okay, I'll take a look. I wasn't aware that there was a Q&A and a chat. I'll look over there.
I was just looking around. But anyway, the other thing I wanted to suggest, first of all, really interesting. Thanks for doing this. But I also wanted to suggest that a thing to look at in terms of the very low income and the changes in centers is that one of the big changes, of course, with 2014 was the rapid leaving of family, friend, and neighbor license exempt home-based providers, right? Which in some states is a very large part of the home-based market. So I think what you're finding is that the move towards centers, the difficulty of enrolling those providers for many states, the disincentive to enroll them is probably really affecting families who are working non-traditional hours, who we know are much more likely to be families of color. Anyway, so I think there's a cycle in that space that has to do with all of that and the reauthorization changes that would be interesting to play with.
Yeah, absolutely. And we've got a separate project that we're doing focused on license exempt providers in Michigan, but I'm also really interested in the kind of work that the new home-based care center that OPRE has funded, what kind of insights they can develop in this area. I think it's a really critical area. I'm primarily a sort of a market modeler when it comes to childcare, and sort of the invisible market of family, friends, and neighbor, and how to measure actual participation in childcare in the private market outside of these public programs is just a gigantic challenge for researchers. And it makes it really challenging for policymakers to kind of grasp what's happening in the childcare market on the ground.
Well, I just wanted to say one other thing about that quickly, which is, and I kept on meaning to send out a note to everybody about this, but Kelly Dwyer and I did a paper this summer looking at just the extent to which states rely on license exempt home-based providers, relatives, non-relatives, in the provider's home and the child's home. And it's really interesting because there are a few states that rely on it a lot, and there are many states that don't at all. But again, I think when you're thinking about state variation, it is really important to recognize that California is going to look very different on that front than many other states. So it's worth exploring that piece of it, even within the administrative data. There's in the states that do it, it's a very large proportion of the providers that they pay over the course of a year, sometimes 50% of the providers in the state, because there's more turnover and a smaller numbers of kids. So anyway, I'm just flagging that for people because I think it's a hidden piece of this conversation that is really important. There's a lot of populations we care about.
That's great. Can you drop a link to that that manuscript in the chat so that people
Well, I
can take
can't
a look
get
at
into
it?
chat, but
Or Q&A, wherever.
I'll put it in the Q&A and then you guys can put it in chat. How's that? Because I'm not sure if
Yes.
anybody else can see the Q. Okay, I'll be happy to do that. So
Thank you. Other questions?
Nathan, did you see the question from Isabel regarding asking for clarification on how you're defining and measuring equity?
Yes, that's always a kind of a loaded thing. There's a lot that goes under the hood with equity. So generally, we were thinking of equity as our families with similar employment and financial statuses equally likely to make use of the program. However, you have to qualify that because the purpose of the CCDF program, I would interpret it as it's really, you're trying to prioritize the families who are most in need. So if those in deep poverty are less likely to use the program than those who are not in deep poverty, that would suggest that there's some inequities in the program and it's not really living up to its potential. And although families who are above the poverty line may be in need, I would suggest it's probably incumbent on us to be concerned that they represent a plurality of all of those receiving the subsidy. See other questions in the chat. Oh, thanks, Gina. I appreciate that. Yeah, Deborah Holtzman raised a really good question in the chat about whether families in deep poverty are less likely to participate because they have stay-at-home parents and they're less likely to need care. So we're modeling this eligibility using ACS data, assuming that all family members, all adults in the household are working, and that no, we're not. What are we? Okay, I'm misspeaking then. Craig,
there's an employment status. We define whether or not they're working, and then we code based off of that. I'll say that in most cases that a family enrolls is if they're either a one-parent household or one parent isn't working. But in most states, it looks like, I can give you definitively in Michigan, the state I do most of my work research in, it's much easier to get enrolled if you're a one-parent household than it is as a two-parent household. And that overall, you see that one-parent households are enrolled far higher across all states than two-parent households are. So it could be something of that nature, right? That more families in deep poverty are more likely to have two-parent households, and one of them is staying home. Yeah, that's possible. But through the ACS, we have the employment status of all adults in the household. So we know whether or not they're working.
Other questions or comments? Oh, I see something's popped up in the Q&A. All right, so, Haley? You want to ask your question?
Okay, got it. Sorry, I was trying to figure out how the unmuting was working. Hey, Nathan.
Hi.
Yeah, I guess I've been sitting here contemplating this idea that you have to be down at 50% FPL to be in deep poverty, because I've also been in conversations where we consider 100% deep poverty, and thinking about, what it sort of looks like to be at 50% FPL. I was just trying to do some very fast back of the napkin math about if you made $10 an hour and worked full time, you'd be at 100% more or less if you had one child and you were a single parent with one child. So if you're even just thinking about how state minimum wages or local minimum wages interact in this, what has to be going on in your life for you to be at 50% is, I think you have to be in a fairly complex circumstance with a very low wage and probably not full-time hours. And I think we sort of know from qualitative work that lots of people have done over many years that like the program doesn't work very well for those people, like that the program, like either center-based hours don't work very well, or this is just not, we're not picturing somebody at 50% of the poverty line with like a full-time job and stable employment. And so thinking about, you talked about administrative burden, but I just sort of wanted to put a finer point on the fact that 50% is tremendously low, and there's like a lot of complexity that goes into being at 50%. And I think I personally, and I come from a very, very low income state, as you know, do not have a lot of qualms about a lot of people under 100% getting this benefit. I feel like they are still in that really high need category. So that doesn't ring like a lot of equity bells for me. And I actually feel like people under 50% need different things. Like they need like a set, like they need sort of oftentimes other kinds of wraparounds maybe than just like, here's some help paying for childcare, because there's probably more going on there. Anyway, I'll stop.
No, I think that's, I absolutely agree with your statement. I think it's a great point. And it's, we're working, you know, on the working paper, we need to think about how we present that. I think what we were going after was sort of the more general point, which is that because we've got some income data, we can sort of like, what's the distribution within this larger group of those who are eligible for the program, and trying to cut that along the poverty line. But certainly within states, and even nationally, you're going to see a lot of differences in what those numbers really mean, going back to sort of the cost of living questions. But your point about the CCDF program not serving them very well sort of speaks to their underparticipation in this. This is sort of like, here's another example that they're not being served by the child care subsidy system in the way that families in other circumstances are. But I take your very friendly critique seriously, because I think that's an important thing that we need to think about in presenting this sort of data that's just sort of very cut and dried quantitative, where are we going to draw lines data. So thank you. Daphne? Where's Daphne?
Hi, yeah. I wanted to ask a question around scarcity of available care and available eligible care and available eligible high quality care. I mean, and so in some areas there are child care deserts where there are no centers that are qualified to receive subsidy, right? So like in my state, you have to be participate in the quality rated system in order to be deemed eligible to receive subsidies from the state. And then also in rural areas, there are just not a lot of centers there. So my assumption is that for some families, they don't utilize the program or the services because it's just not there that's close to where they live, and their life is very complicated. They may take public transportation or may not have transportation at all. So have you ever done any geocoding to look and see where the very, very poor people live, and if how many centers or are there adequate eligible programs close to them? Because my assumption is that we're assuming that they don't go because of a lot of reasons. They may not go because it's not available for them. So the only option that they have could be family, friend, and neighbor care or family child care. So have you compared actually where people live and available programs to see if there may be some relationship between those two?
There are really good researchers who've done some of that work at the state level, and there's some national databases as well. We know that there's a problem. You're absolutely right in terms of availability. But one thing I really want to key in on is that point you made about state rules about who's eligible for childcare. So the more restrictive the rules are, not just in terms of eligibility for families, but what kind of childcare providers can receive the subsidy and offer care through the subsidy program, can have a huge impact on a family's ability to use the program and to get quality care. I think that's a really great point. But yeah, I know of several research groups that have looked at it either within states and have done the geocoding. It can be challenging though, because if you're looking at oh, thank you, Susan. Someone mentioning one of those many sources that are out there. Yeah, there's some great work out there that's being done on this. It is very challenging when you're trying to compare that to the eligible population, because the American Community Survey data is at a higher level of aggregation. So they sample units of 100,000. So you can say within, multiple counties in rural areas, or, a within county area for a large urban area, that in this area generally, but it's really difficult to match up in a fine-grained way family need to care. And on the other side, we know about licensed care, but we don't really know how many functional available slots that they have, because they're licensed up to a certain number of slots. But we don't know how many slots are actually there. And we don't really have any good data outside the subsidy program itself about private providers who are, home-based, or in unregulated care. So that gets to that whole humongous challenge that we have as policy researchers, and policymakers and advocates, trying to get a handle of really what's happening in terms of the availability of care. But you really put your finger on it.
Yeah, I also want to note that I forgot to mention this previously, but the CCDF administrative database, the national one, is a sample itself, and the sample doesn't get quite fine-grained enough to be able to do that kind of geocoding or even a micro level. State level's really kind of the lowest level you can go with it. So any type of research about that regional disparity in those childcare deserts has to be done on the state level, like state data. And as Nathan noted, many people have done it. We did some of it in Michigan, and other people elsewhere have done better versions of it in their state. So,
yeah, I think it kind of teeters towards really equity, right? So where the funds are intentionally done so that people can go back to work, and two-generational approach to come out of poverty, economic security. And it's unfortunate they don't have accessibility to what was designed for them to get that. And then also the lack of coordination, again, with Head Start, to even get some level of care, and the need for those kids to start early learning very early to reduce some of the negative outcomes that could happen if they don't expose to that. So I think it's a real equity issue for children. And I think it's like goes under the radar, and nobody really talks about this program that was designed to take people out of poverty. The people that are most impoverished has least accessibility. So if you are pretty relatively stable and you are working a regular job that between 6 and 6 or 6 and 7, whatever it is in your particular center, and you can get back and forth to some level of care, then it fits you best. But the kids that are very chronically poor, they don't have equal access to something that they really need.
Yeah, absolutely. Yeah, those are all great points.
We have a question in the Q&A. Do you think the downward trend is because of the expansion of 4K in public schools combined with a scarcity of infant child care supply?
Maybe. I mean, that's sort of like this is something I didn't make really clear enough, is that this is really a first cut exploratory analysis using the administrative data. There's a lot, because we can look at this at the state level. You can look at the state policy environment, and whatever other data is available at the state level, you can merge with it. So there's a ton of questions and nuances and possibilities that we need to explore here. This is really just a first attempt, like what's the broad picture nationwide and over time. So we're planning on doing more work using this data to try and dig into some of these questions. Particularly, I know Craig and I are really keen on unpacking that the role of sort of socioeconomic status with respect to income and the sort of changes that we've seen over time. But state policy context and how they're shaping the rules for eligibility, the size of their copay, et cetera. There's a lot of avenues for work. And I think if there's one thing I would hope people would take away from this, other than the substantive findings, which, as every researcher will say, are always tentative, which is that this is a really useful data set that you can merge with other state data sources. And we really hope that people make more use of it than they have previously, because you can really dig into some of these questions in a really helpful way and develop some new insights.
The downside, of course, is that it's still 5 years behind. They haven't updated.
It is still 5 years behind.
The Urban Institute CCDF policy database is also a couple years behind still. So if you're looking for updated rules, you'd probably have to check in with your local state, because I think Urban Institute hasn't updated since 2022, I want to say. Someone who probably knows that better than me, but that is also a little lagging.
So we will say that it's a huge task to gather that data. So we're not criticizing our friends at Urban. It takes some time to process. It's just, as researchers, we're always like, we want the data now. But as with the American Community Survey and with processing what's in the CCDF Administrative Data Series, it takes time to clean that data, to process it, and to get it in the right condition for public use. But it does mean, because of the lag between when the rules are passed and when we have a good data source for it, that it can make it challenging. I mean, we're all eager to see how this is unfolding after the pandemic and the massive changes in the childcare market we've seen, both in terms of what's happening on the ground, so the short-term exogenous shocks, and all these policy initiatives that went into place. There's some state-level research which has taken place, which is taking advantage of state-level administrative data. But we're a long way away from knowing what's happening on the national scene, just because of the intrinsic difficulties of getting access to this data.
Gina notes a thing I was mentioning earlier, that there is a micro-simulation level eligibility estimate that OPRE uses for state level estimates. And Urban Institute is the one that manages that. So it does a pretty good job and relies on CPS data. It does something similar to what our model does. I tried to compare it, but I don't quite have access to the micro simulations, and they've only published a few years worth of numbers. So,
remind me, with the TRIM model, is that child-based or family-based? Because I know ours was explicitly family as the unit of analysis.
I think it was child-based.
Yeah, so you'll get slightly different numbers there. Okay. Any other questions or comments? Well, thank you everyone for taking the time. I've really enjoyed this. I'm really excited that we had so many people attending and so many great comments and observations. And I hope that you all have a wonderful rest of your week. And thank you so much for taking the time.